All right, when I was diagnosed with breast cancer, I immediately wondered, how did I get this disease, right? It's a big question. And with more than 1 million new U.S. cases every year of cancer, hospitals have a big job of keeping up with the latest technology and testing in hopes of finding that answer for more people. So today we have Susan Fantini. She's a genetics navigator with Licking Memorial Health Systems. She is here along with CEO Rob Montagny. So thank you both for being with me.
Good morning. It's great to be here.
Good morning. It's a beautiful Friday,
It
right?
is. It is.
All right, Rob, let's talk about this. You know, it's the potential of a cancer diagnosis. I think because it is so prevalent in so many families, a lot of people kind of think, well, what would happen to me if I were in that situation? And you at Licking Memorial really support the community through your program. So tell us how you do that.
Sure. I'm going to take a little bit of a jog to the side. Speaking of families, I want to congratulate my daughter who's graduating from high school tonight.
Oh, that's big.
I know you have a 19-month-old,
Yes.
and before you know it, you'll be saying the same thing and thinking, how did this all happen? So we'll be at Watkins Memorial High School graduating. So speaking of family, that's the tie. You know, we spend a lot of time and energy on the cancer screenings. We have a wonderful oncology unit to care for folks once they have the diagnosis. But I think historically, when we've talked preventive care, we've talked about those screenings, the mammograms, colonoscopies, things of that nature.
Sure.
And we're even moving further back now with the genetics navigator and looking at family histories to see who has the highest likelihood based on those family histories and based on the types of genes they have that we can identify even before those screening tests would show the cancer. And I think that's what we've been able to bring to a community hospital setting, which is fairly unusual to have this type of care and clinical capability at a community hospital.
And really expertise, because we hear about patient navigators. We don't always hear about this genetics specific navigation. So Susan, tell us what it is that you do in that role.
Well, a genetics navigator is someone with an advanced education in human genetics, in genetic testing, and the interpretation of those results, and then also in hereditary cancer risk assessments.
So what is it that you can do for a patient? So somebody comes in, and if they do have a family history, would that kind of put them in your radar, so to speak?
Well, the patient would come in, they fill out a risk assessment form in the physician's office, and I take a look at it. If it needs further clarification, we can get into the cancer risk in the family, the history that the family has, and then also looking at trends and seeing if there is something that makes this patient high risk for a hereditary cancer in the family, running in the family.
Right, and so if you do find a high-risk patient, what does that mean for them? What exactly would be the benefit of finding that out?
Well, knowing that you're at high risk, we would then educate the patient, offer education to the family, and then also they could go into a protocol where they get earlier screening at a younger age. So screenings with mammograms, colonoscopies. We also have some melanoma clusters, so we would send those patients to a dermatologist and make sure that they are screened younger and more often.
And we all know the early diagnosis, I mean, that's a key in most every cancer.
Absolutely.
In treating it successfully.
Mm-hmm.
Okay. All right, Rob, and you do have a number of cancer-related community support events because you guys always get out there. You want to let people know that you're there, not just for the patient, but for the whole family when something happens.
Yeah, no question. We have a lot of events coming up this summer. Our Cancer Survivor Picnic will take place in just a couple weeks, and I think on the screen it's showing some of these events, but this would be for anybody who is a cancer survivor, whether they receive care at our facility, somewhere in Columbus, or somewhere else in the country. But it's an opportunity for them to sort of network and share their stories. We have Camp Courage or Camp Courageous for the youth. These are for children that either have been diagnosed with cancer or live in a house where a loved one has been diagnosed with cancer, and it's fun for the kids. We do a little bit of education, but a lot of fun. And cancer screening events throughout the entire summer, especially a lot of the skin cancer screenings we'll be having at the various fairs and activities that are out in the community.
Yeah, you guys always make it, easy for people to get educated, get the information, because that is the goal, especially of a community hospital.
Sure. With
what you're trying to do. So
yes.
Thanks for doing it all.
Yeah. Great.
All right, lmhealth.org is the website for Licking Memorial Health System. So thank you guys for being here.
Thank you for having us.